Hello, my name is Destiny. I'm a student here at North Carolina Wesleyan College. While there are many theories that relate to exercise behavior, today we'll be discussing three. We will be discussing the trans-theoretical model, the social cognitive theory, and the theory of planned behavior. Let's get started. Now, before we can jump into our theories, first we have to understand the idea of self-efficacy. Self-efficacy is one's belief in their ability to complete a certain action. And this relates to more than just exercise. This can relate to many different things. And the figure on the side is just an example of how we would use that and how you would see self-efficacy in a regular setting. So let's jump into the social cognitive theory. The social cognitive theory is based around reciprocal determinism. This applies to the individual's emotions, personality, cognition and biology, their behavior, and their environment, which can be physical, social, or cultural. And all these things play a role in the influence of behavior. Social cognitive theory focuses on punishments and reinforcements to help someone correct or change a behavior. And this is done in many different ways. And as we talked about before, self efficacy is a central part of this theory. One thing that this theory looks at is outcome expectations and expectancies. These are key to the social cognitive theory. Anticipating results of a behavior and the value of these are placed on the results. So, for example, say an exercise that you perform, you expect to lose 30 pounds. You anticipate losing that 30 pounds by the end of the exercise program. Well, this theory is so that by the end of that program, if you don't lose 30 pounds, instead of giving up, what can you do? What can you change? What worked for you? What didn't work for you? What can you reinforce? What can you get rid of? Another important concept to the social cognitive theory is going to be self-regulation and self-control. This affects your goals, how you view your progress, how you move toward your progress, and how you solve problems that you face during this time. Say you set out to join a gym membership and you're excited and you're ready, and then you find out, well, that gym doesn't have what you want to do, or that gym doesn't offer as many programs as you may have thought. How do you face that? How does that affect your goal, your end goal? And of course, self control is always a big part of it. Any type of exercise program is how you conduct yourself during the exercise, how you conduct yourself with sticking to an exercise. What makes you get up and say, I'm going to go to the gym today, or I'm going to exercise today, and I'm going to do this 3 days a week for the next 6 months. I'm going to continuously do this so that I stay healthy. That's all an important factor in changing that behavior and affecting that behavior so that you don't start doing this thing and setting this goal and moving toward this goal, and then you decide to get lazy, or you decide, I'll do it tomorrow, and tomorrow never comes. It's constant pushing towards that progress. All right, let's move into the trans theoretical model. This model is based around individuals at different stages. Now, depending on where an individual is in the 5 stages of the trans theoretical model, is going to determine how you formulate an exercise intervention. So let's go through the stages, starting with the pre-contemplation phase. In this phase, the individual has no intent of starting any type of exercise program within the next 6 months. Now, once this individual decides, you know what, I'm going to join a gym, or I'm going to I'm going to try to be active. They are now moved into the contemplation phase. This means that that individual has intent to starting an exercise program within the next 6 months. Now, once they start buying things like new running shoes or a nice pair of workout pants or planning to go ahead and get that gym membership or maybe even buying that gym membership, now they're in the preparation phase. Now they're preparing for that exercise within the next 30 days. Now, once they decide today is the day I start, and they put on those new running shoes and those new workout pants and they go to the gym and they get started. Now we're in the action phase. Now we're completing that exercise regularly for 6 months. Now, most people struggle with the last part. And here's where you see a repeated back and forth between action and maintenance. Maintenance is described as regular exercise that has been completed for more than 6 months. So oftentimes people will stop and restart, or they're not consistent through that entire time. And a lot of times people will go back and forth through sometimes through the entire cycle. Sometimes they'll stop exercising for years and decide, okay, I'm going to do this. I'm going to get back into that because I like the way it made me feel. I like having that exercise in my day or in my week. And they start the cycle back over again. And this really comes into, again, like I said, making sure that when you're creating an exercise intervention that is specific to the person in their phase of the trans theoretical model. You don't want to suggest to somebody to go join a professional cycling class if they're only in the contemplation phase, because sometimes exercise can tend to intimidate if it's something above their exercise level or their physical activity level. You want to give them something that's going to make them more encouraged to do it. And oftentimes this can include other people. Some people do better exercising in groups. Some people do better exercising alone. And all of that determines how we create an exercise intervention, how we incorporate that exercise into that person's life, that they're comfortable, that they're enjoying it at the same time. All right, so let's jump into our last theory. We're going to be talking about the theory of planned behavior. We're going to go through each of the three parts of this theory and how they push or pull you from an overall action. Let's start with behavioral beliefs. This is your attitude towards the behavior. Is that attitude negative or is it positive? And how does that make you either want to do an exercise or not want to do an exercise? For example, let's say you want to start exercising and your friend suggests, hey, come run a marathon with me. That's going to make you think a little bit. If you've never run a marathon before, or if you've never run before, you're going to see that as being something that's a little out of your reach or difficult. And that's going to make you think or not even want to run that marathon with your friend, let alone safety issues of someone who's never run a marathon and tries to run a marathon. But that can determine how you feel towards that behavioral change. So say that same friend, instead of suggesting a marathon, says, let's go to the gym and get on the treadmill. Or let's go to the gym and start our own exercise program and start slow and build our way up. That's different. That's achievable. That's within your reach. So that's going to change your intention towards that behavior. now you want to do it. Now you can see yourself doing that behavior. So moving into normative beliefs, subjective norms. This can affect you in a little bit different ways. This is the social component. And this is more, do you want to be physically active? Your motivation towards it, how it makes you want to do these things. So say all of your friends are physically active, but you just don't have the motivation to do it, or you feel like you don't have the time, or you feel like you can't do it, then your intentions to change that behavior aren't going to be there. You're going to be complacent and content with where you are. But say all of your friends are active and you decide, that's something I want to do too. I can see myself being there. I'm motivated. I want to do it. Now your intention is there, and now you're going to change that behavior. Lastly is control beliefs. And this is the idea of perceived behavior control. And this is influenced by how someone perceives a difficulty. Like I mentioned before, if you see an exercise as something that's being too difficult, you're not going to want to do it. But if you think that that exercise is going to lead to an outcome that you want, that can push you to want to do that exercise. And sometimes this doesn't always increase intention, but sometimes perceived behavioral control can have a direct link on behavior. And it may not always directly limit an exercise. If you have a positive attitude and you decide, this is what I want to do, I can see myself doing it, and there's no need for intention. You see it, you do it. You don't think about it. You don't wait around to discuss it. You complete it. And that skips that intention and goes straight to that behavioral change. Thank you guys so much for watching. I hope that any or all of the theories that we discussed today can help you. And remember that these don't always apply to exercise, but they can apply to everyday goals as well. So next time, take time out and think about where you stand with your goals. What are your goals? What do you want your goals to be? And how far are you away from achieving them or even starting towards them? Again, thank you guys for watching. I hope you enjoyed. I hope this was helpful to you or someone you know. And until next time.